It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Kandace Krueger, and welcome back to another edition of the Best Docs Network. Features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. Like our first best doctor, right, Kandace?
That's right, Jim. We're going to kick off the show with a minimally invasive general and bariatric surgeon. It's Dr. Preeti Malladi.
I decided to enter the field of bariatric surgery and focus my practice and also become specially trained in this field because it has such a profound impact on patients' lives. Patients have been struggling for years with multiple medical conditions and sometimes even low self-esteem, and when they come to my office, I can offer something that really can be successful for them.
I decided to have the sleeve procedure when I got tired of being tired and not feeling good. With me being overweight all my life, I had a doctor tell me one time, he said, "Vicki, your knees were not designed to carry what you are making them and have made them carry your whole life." Before I had the surgery, it was always hard going on vacations because walking anywhere, I can remember a few years ago, I went on a trip to New York with my daughter and I thought I was going to die. Needless to say, I was always the straggler. We did everything through the subway, up and down the stairs. It was horrible.
So it's really exciting to work with patients and then perform surgery and also work with them for their lifestyle change and then see the changes happen. And the great thing about bariatric surgery is that I have a lifelong relationship with patients. I see them post-operatively, I see them for years afterwards, so I can see how they're doing in the short term and in the long term, and see them come off their medications, see them lose weight, see them gain energy and feel great about themselves. And the most important thing is that they're able to live longer, have a better quality of life in the end, and be able to enjoy that with their families.
Dr. Malladi, I just can't say enough good things about her. She is a genuine person. She's a very caring person. If somebody said, "We were going to shoot you if you do not say something negative about her," I'd have to go, "Shoot me." I've lost, since I've had my surgery, 85 pounds. I feel fantastic. I feel like I look good. I just feel so much better. I feel alive.
Eating potassium-packed picks such as bananas, cantaloupe, and oranges may help you to be less prone to high blood pressure. In addition, reducing sodium intake and taking other heart-healthy steps will also help to manage your blood pressure.
Bob's teeth were worn down due to grinding, but now he has a beautiful smile thanks to Dr. David McFadden. To find out more about Bob's story and other life-changing stories, log on to bestdocsnetwork.com.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The Aspen after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because that's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the Aspen after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
All of our doctors here at the Best Docs Network are dedicated to changing people's lives. And our next best doctor is no exception. It's cosmetic dentist, Dr. Guy Lewis.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is, the majority of the time, a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
Don't forget, for more information on any of the doctors you've seen on today's show, or to even request an appointment, be sure to visit our website, bestdocsnetwork.com.
Bestdocsnetwork.com. Kandace, of course, the place to go. Right now, the place to go is our next best doctor. It is plastic surgeon, Dr. David Azouz.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think She has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, you know, pulled up the neck and, you know, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, you know, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. You know, nobody's pressuring you. So I just felt comfortable with him.
Welcome to the Best Docs Network in the studio. We're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible, incredible journey, and I sort of fell into that.
Really?
Went to a charity event many, many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery. And then I think it's like 50 or 60 Cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. Patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
Well, I've kind of always wanted to have larger breasts, but I was married and my husband didn't want me to do it and had a bunch of kids, and so I had a life change. In the 90s, one of my good friends had used Dr. Barnett, and she goes, "Kim, you're starting your life over, go see Dr. Barnett."
Breast augmentation is where there are several incisions. The only one that makes any sense is right here where the crease is. You make an incision, you open up a space for the implant to sit in. Very important to put it on top of the muscle. You make a space, You have already decided what size implant that they need. Why? How do you decide what they want, what they need, how big have they been, how big are they now, how tight is their skin? Or you make the operation fit the patient rather than vice versa.
Afterwards, I was here for hours recovering, and I had a friend take me home, and I slept through the night. Waking up, I had very little pain. After about 4 or 5 days, I was pretty comfortable in going and doing. I took a couple days off of work, and then I was back at work.
When Kimberly came in, she needed some changes in her life. She needed her breast done, or wanted them done, and she wanted a new figure. So that's what we did.
It's great. I love it. He did a great job, and I'm very happy with it.
Her breasts are fabulous, if I do say so myself, which I will. They fit her body. She told me a minute ago, she looked like she does now when she was 28 years old. And that's what we did for Kimberly. We just gave her a boost in self-esteem. She's happy. It's win-win all the way around.
Dr. Barnett was very personable, very funny and nice, and he takes time to know you, and he lets you know him. And so then you kind of have a relationship before the surgery. So you feel very comfortable, and you trust him, and it was a great experience.
If you eat healthy, you're going to be healthy. So what are the major rules for eating healthy? First of all, eat breakfast. It takes your body off that emergency that you've been on overnight. Emergency isn't good for your body. It causes lots of problems with blood pressure and cholesterol. Secondly, eat anything that is red, orange, or green. Those types of foods that are red, orange, or green tend to have what's called phytochemicals. They tend to be antioxidants, and they prevent heart attacks, strokes, and many cancers. Eating a Mediterranean diet is a great idea. The Greek people have a wonderful idea about what to eat. They eat a lot of beans, a lot of fiber, not much in the way of red meat that's high in fat. Fish is an important part of your diet. We need to eat less red meat in America and more fish, and also more non-red meat like the white meats like veal, chicken, turkey. Red meat has more cholesterol. Also, barbecued food is not a good idea. The barbecued flavor occurs because the smoke deposits chemicals onto the surface of the meat that taste good, but they also tend to be cancer-causing chemicals. So limit your barbecue to once a week.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab.
For dry skin, incorporate more avocados into your diet. They're rich in monosaturated fat and vitamin E, both of which promote healthy skin. Try them on salads and sandwiches, and even in smoothies.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them. But what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem, and that's one of the most satisfying parts.
For more information about any of our outstanding doctors you see on today's show, even request an appointment, head to the website, bestdocsnetwork.com. That is bestdocsnetwork.com. Right now, it is time to head to our next best doctor. It is bariatric surgeon, Dr. Philip Swanson.
Well, Anna was about a little over 200 pounds. She had diabetes and high blood pressure.
I had sleep apnea, and I didn't like the way I looked. And I hated that when I would go to the doctors, they would write down obese. And I didn't think size 18 was obese, but medically, it was considered obese.
We talked about the different kinds of procedures that you can do for weight loss, and she wanted the lowest risk operation that you could possibly do, which is the band. And we spent some time discussing the fact that this is a restriction, and you have to be a very dedicated person in follow-up, that you have to carefully follow your intake, and after the few bites that you eat and then you feel full, that's when you need to stop. We all know that your weight is dependent upon how many calories you take in and how many calories you burn. And so if you can burn more calories, then you can lose weight. If you can take in fewer calories, you'll lose even more weight. And she's done very well with this.
I give myself a goal to reach. Once I reach that, then I try another exercise. So I did Zumba, and that was fun, which I would never do when I was fat. It's been an ongoing journey. It's been a positive one. I've enjoyed it every day because every day I see my scale go down. And it's nice to see those numbers go down, going down instead of going up. Every year prior to that, my numbers went up.
She's lost down to about 130 pounds, and the benefit of losing that weight is now her diabetes is essentially resolved.
The sleep apnea is gone. I sleep much better at night. Now I'm a size 8, and I've even worn size 6s, and when I pick them up, I think that is too tiny. And then when I walk by and see myself in the mirror, I have to walk back again and say, is that me? I hadn't seen myself skinny, not since high school. You're hot. I like what I see.
I was very apprehensive about coming into preferred imaging. The night before, I had read every negative thing that could happen when you have an MRI. So when I came in the door, the secretary met me, just smiled. And the technician for the MRI was just really helpful, very reassuring. I was so happy I'd come to preferred imaging.
So I had saw a physician out of town, and he had looked at both MRIs and was wanting to order a different MRI. And he preferred the one for preferred imaging better than the other one and asked me would I return here for the one he was ordering. So we did, and he was very pleased with the second one that I had here as well.
And the setting, the waiting room, and the changing room all were really nice.
Their room is really painted pretty neat. It's very artistic, and just kind of makes you feel like you're not in that normal cold hospital type feeling, just more of a warm type feeling.
The staff was uplifting and answered all my questions, and the procedure was so stress-free. The technician gave me a button to push if I needed help instead of wiggling my feet and trusting that somebody was going to see me. The first thing I did when I was inside the MRI machine was to test the button, and she immediately came and pulled me out and said, "What do you need? Is everything okay?" And I was like, "No, I'm just testing the button." And she was like, "Oh, that's okay. I just want you to know that I'm here and I'm watching you and you have the button." And so that was very reassuring. And then the procedure was just like they said. I had an absolutely fabulous experience at Preferred Imaging.
I also live 2 hours away, but I am in a small town and the imaging there is mobile and it's not very well. So I do travel up 2 hours so that I can get good quality imaging. And so when the doctors like it and prefer it, it's worth the drive of 2 hours.
They're really friendly, really nice, very helpful. It was I really did have a good experience here.
Hi, I'm Dr. Preeti Malladi. Did you know that gastric bypass can not only help you lose weight, but have a profound impact on diabetes? To learn more, please see my videos on bestdocsnetwork.com.
Eating slowly will not only help you feel fuller and more satisfied, it can also help prevent indigestion and heartburn. So slow down and enjoy your meals.
Mohs surgery is a surgical technique for the removal of skin cancer that enables us to examine all of the surgical margins of the tissue that were removed so that we're sure that we've gotten all of the skin cancer.
The first time I had any problems was out in California. And I had some work done in here. But the doctor told me, he says it might come back because they didn't have the Mohs system at that time. Then I had this one.
Mr. Waddy, you're presented with a recurrent squamous cell carcinoma involving the right posterior auricular area. The posterior auricular area is the area behind the ear and extends onto the anterior portion of the scalp and the upper portion of the neck. It also involved the posterior aspect of the right earlobe. During Mohs surgery, we were able to get a clear margin. I believe it took 3 stages of Mohs surgery before we had clear margins. The resulting wound was approximately 3.5 centimeters long by 2.5 centimeters wide. What we did was come up with an advancement flap that required removal of Burroughs triangles, small little triangles of tissue at the superior and inferior edge of the wound. We then undermined the tissue, advanced it to the edge of the posterior auricular sulcus, sutured that in place, and then used one of the Burroughs triangles that were excised as a skin graft for the defect on the posterior aspect of the right earlobe.
So you had to do a little patch in there. See, the ears aren't the same. I lost part of my ear here. It's healing up a lot better than I thought.
Well, he's now 4 months post-op. All of the sutured areas have healed very nicely. The skin graft took very nicely, and everything looks perfect.
These make you feel relaxed all the time. It really is nice.
That'll do it. That'll wrap up another edition of the Best Docs Network, featured some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And for more information on any of these outstanding doctors, even request an appointment, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And as always, if you have a question or comment for us, or if there's a doctor that's helped change your life, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.